Hi, I'm Laura Siminoff, Dean of Temple University's College of Public Health, and joining me today are three of our faculty experts, Graciela, Jaschek, Heather Murphy, and Krys Johnson. So more people are now getting vaccinated, and overall across the United States, there's probably about 9% of the public who are fully vaccinated and about another 9 who are partially vaccinated. So as we move forward with vaccination, I think that there are some different issues that people are grappling with. So let me ask Graciela first. We now have 3 vaccines that are approved for use, but increasingly there are questions about their effectiveness or whether they are all equivalent. Could you provide some guidance for us?
Yeah, sure. Laura, the 3 vaccines that have been approved by the Food and Drug Administration are the Moderna, Pfizer, and Johnson & Johnson vaccines. The Moderna and Pfizer vaccines were approved in December, whereas the Johnson & Johnson one was approved last month. You may also have heard that people need 2 doses of the Moderna and Pfizer vaccines, but only 1 dose with the Johnson & Johnson vaccine. But what we need to focus on is that the 3 vaccines are equally effective at eliminating death, and they all drastically reduce the number of hospitalizations. Hospitalization and or death as a result of COVID-19 is what we call severe disease. But we keep hearing about the different efficacy numbers, 94% for Moderna, 95% for Pfizer, with Johnson & Johnson at a lower figure of 72%. And this leads people to believe that the Johnson & Johnson vaccine is not as good at protecting us against severe disease. Is that a fair assessment? Not so. There are 2 considerations that come into play. First, the Moderna and Pfizer vaccines measured efficacy only against severe disease, whereas the Johnson & Johnson vaccine measured efficacy against both moderate and severe disease. So of course, the Johnson & Johnson number is lower because it includes measuring efficacy against both severe and moderate disease. Second, the clinical trials were held at different times during the pandemic. So the Moderna and Pfizer vaccines were conducted earlier, back in December, before the new variants appeared. Whereas the clinical trials for the Johnson & Johnson vaccine happened later when the variants had already started spreading. So this difference in timing may have impacted the results also. So is one vaccine better than the other at preventing death and hospitalizations? The answer is absolutely not. They are both dramatically effective. They are all dramatically effective at preventing severe disease. And that's really good news, regardless of the vaccine brand we receive.
Thank you so much. I think that's probably one of the more cogent analyses I've heard of this ever. So Heather, the more I hear about the new virus variants, the more I feel that the vaccine is not really going to end this the way we had hoped at the beginning of all of this. Could you discuss this and whether you think we will have to continue to live with this disease, even if vaccinated, and what living with this disease might look like?
Yes, Laura. So at this time, unfortunately, I think the virus is here to stay. And although the vaccines will help us get back to what we call like closer to a normal life, there's a lot more we need to know before we can stop mask wearing, social distancing, and for like international travel quarantining. We need more people vaccinated. And then we also need to learn more about how effective the vaccines are against these variants and more about the vaccine's ability to prevent infection. That's something that's still widely unknown. At this time, we know the vaccines prevent serious illness, like Graciela said, which is really great, but we don't know if the vaccines prevent people from getting infected and subsequently spreading it to others. So unfortunately, I think we'll be wearing masks for the foreseeable future. People might be required to carry vaccination certificates, kind of like this one. This is a yellow fever vaccine certificate. And if you want to travel internationally, there's many countries talking about what sort of vaccine passport might be required. Now there's issues of equity associated with carrying such a kind of a passport, and will everyone have access? But that's something that I think a lot of countries are seriously exploring. And I think Israel has actually instituted one to date. I think if you want to be able to, say, travel to Australia and not have to quarantine for 2 weeks, you're going to need this vaccine passport. And even that might not get you out of your 2 weeks quarantine. So countries that have managed to keep the virus out of their country, I think they're going to be still extremely vigilant in terms of the measures in place. I, for one, think I'll probably wear a mask to the grocery store and on flights for the foreseeable future and maybe forever, because I find I'm not getting sick anymore. So some extra protection might be good against any virus.
Well, I know that my year of isolation has absolutely prevented me from getting a cold. I have had no colds whatsoever. I guess that's a minor plus to this whole thing. So Krys, finally, there are definitely people who are more at risk for severe infection than others. And could you review that for people so they can consider their own personal risks as they try to come to grips with how they personally are going to live with the virus? I suspect that as we get further and further out and more people are vaccinated, people are definitely going to be doing some different things for themselves.
Right. So as it stands, there are multiple conditions that make a person more susceptible to severe COVID-19 and death due to COVID-19. It makes sense to us that things like cancer and chemotherapy and immunocompromising diseases can increase risk, but there are a lot more common things that increase that risk as well, like Down syndrome, obesity, which we know is very prevalent in this country, pregnancy, especially in our young population, is very prevalent. Smoking, and even type 2 diabetes, which again is booming in this country, unfortunately. All of those things are linked to an increased incidence of severe illness and potential death, regardless of people's age. So even an otherwise healthy person who smokes or an otherwise healthy person who is pregnant could die of COVID-19. So that's why these groups are prioritized for COVID-19 vaccines currently. So that said, it might not be evident that people have these conditions. Obviously, people who are pregnant typically don't tell people for the first 12 weeks or so. People who smoke might not let everyone that they know smoke. So to protect people with these conditions and other risk factors, what's important is really to make sure that we're getting vaccinated whenever we have a chance.
What about age?
Right. So age and age-related diseases have also increased people's risk, which is why we've seen some states that have gone along a straight age qualification. The issue with that is that there are several minority groups, though, that don't have very many people who reach that age range. So it's not as equitable as including people based off of these types of conditions. But of course, age absolutely does make people more susceptible to severe infection. And that's why we saw people 75 and older and then 65 and older be prioritized as well.
Okay, thank you. Well, this has been really informative today. As we can all tell, things really just change certainly from week to week, sometimes from day to day. So it's great to continue to be updated around the latest developments. So thank you all for joining us today, and I hope you'll view some of our other videos, find links to reliable sources of information at our website. Do not be discouraged about finding out that something that we knew almost a year ago is no longer true, because remember, this is a new virus and science develops sometimes a little slower than we would like. So please visit our website at cph.temple.edu/coronavirus. Thanks.